The U.S. Food and Drug Administration has approved Latisse bimatoprost ophthalmic solution 0.03% as a novel treatment for hypotrichosis of the eyelashes. Eyelash hypotrichosis is another name for having inadequate or not enough eyelashes. Latisse is the first and only FDA-approved science-based treatment to enhance eyelash prominence as measured by increases in length, thickness, and darkness of eyelashes.
As a dermatologist, I have many patients who express a desire to enhance their eyelashes, but until now there has not been a clinically validated, FDA-regulated option. Now Latisse is available to meet this need and help my patients grow their eyelashes longer, thicker, and darker.
Before using Latisse, my eyelashes were very short, and I've always admired people with long, beautiful eyelashes. And now with Latisse, I can have them too.
Latisse is a once-daily prescription treatment applied to the base of the upper eyelashes, like eyeliner, with a sterile, single-use-per-eye disposable applicator. In as little as 8 weeks, Latisse users can expect to experience longer, fuller, and darker eyelashes, with full results in 16 weeks. To maintain the effect, continued treatment is required. If treatment is discontinued, eyelashes will gradually return to where they were prior to treatment over a period of weeks to months. Latisse will be available in the U.S. by prescription only in the first quarter of 2009. Consumers should consult with their doctor to determine if Latisse is right for them. Visit www.latisse.com for further product and prescribing information.
We're excited to add Latisse to Allergan's medical aesthetic portfolio, reflecting our continuing commitment to developing and delivering innovative, high-quality, and science-based elective treatments to patients under a doctor's care. Latisse was clinically tested in a pivotal Phase 3 multi-center, double-masked, placebo-controlled study to assess safety and efficacy, and all endpoints were met. Latisse, when used under a doctor's supervision, provides patients with a clinically meaningful aesthetic benefit and a favorable safety profile. Similar to Allergan's other medical aesthetic offerings, the benefits of Latisse are derived from scientific evidence, its quality, formulation, and medical origin. Bimatoprost, the active ingredient in Latisse, was first approved by the FDA in 2001 as a medical product to lower intraocular pressure in people with open-angle glaucoma or ocular hypertension. Patients with bimatoprost for their eye condition experienced eyelash growth as a side effect. This eventually led Allergan to pursue a clinical development program for Latisse. So the long-term safety of bimatoprost for therapeutic use has been recognized by the medical community and is well established.
Important Latisse safety information. Latisse bimatoprost ophthalmic solution 0.03% is intended for use on the skin of the upper eyelid margins at the base of the eyelashes. Do not apply to the lower eyelid. If you are using Lumigan or other products in the same class for elevated intraocular pressure, IOP, or if you have a history of abnormal IOP, you should only use Latisse under the close supervision of your doctor. Latisse use may cause darkening of the eyelid skin, which may be reversible. Although not reported in clinical studies, Latisse use may also cause increased brown pigmentation of the colored part of the eye, which is likely to be permanent. It is possible for hair growth to occur in other areas of your skin that Latisse frequently touches. Any excess solution outside the upper eyelid margin should be blotted with a tissue or other absorbent material to reduce the chance of this from happening. It is also possible for a difference in eyelash length, thickness, fullness, pigmentation, number of eyelash hairs, and/or direction of eyelash growth to occur between eyes. These differences, should they occur, will usually go away if you stop using Latisse. The most common side effects after using Latisse solution are an itching sensation in the eyes and/or eye redness. This was reported in approximately 4% of patients. Latisse solution may cause other less common side effects, which typically occur on the skin close to where Latisse is applied, or in the eyes. These include skin darkening, eye irritation, dryness of the eyes, and redness of the eyelids. If you develop a new ocular condition, for example trauma or infection, experience a sudden decrease in visual acuity, have ocular surgery, or develop any ocular reactions, particularly conjunctivitis and eyelid reactions, you should immediately seek your doctor's advice concerning the continued use of Latisse solution. Full prescribing information is available at www.latisse.com and www.allergan.com.